Well, my name is Tony Chandler from the Health Consultants Group, and today we're going to talk about charting a new course, 7 critical methods to lower your employee health care costs by 3 to 30%. As we're all fully aware, health care costs have skyrocketed in the country to national epidemic proportions, constantly in the news and something we're almost all fully aware of. With annual increases anywhere from 8 to 14% on average, small businesses are struggling to keep up with these increases, which are well above the consumer price index. A family plan may cost as much, if not more, than a mortgage for a quality 3-bedroom home. Who would have ever thought we would see such ridiculous rates? In fact, many businesses will admit that health care costs are only running a close second as far as payroll with their overall expenses. In this webinar, we'll explore the 7 critical steps to lowering your health care rates by anywhere from 3 to 30%. So follow along. I'll identify those 7 critical steps. Incorporate a wellness plan, take advantage of telemedicine, offer consumer-driven plans, edit your plan for accuracy, check and recheck, compare self-funded plans, and meet with plan carriers often. Step number 1, incorporate a proven wellness plan. Indeed, wellness does win. It's on the forefront of every publication and talked about repeatedly in the news and in consumer circles. You may notice that based on national health care reform, you now pay a 0 copay for your wellness visit. This didn't come by accident, but through a lot of thought, was passed through the bill with no problems. Statistics have shown that 75% of healthcare claims are a direct result of illness that is preventable. Typically, those include such things as obesity, diabetes, high cholesterol, all which can be controlled through a proper wellness plan. Prime example of lowering your costs would be to just look at the largest insurer in the state of Massachusetts, which now offers a program that provides up to a 5% rebate on your premiums for a healthy workforce. That very same plan by this large carrier also offers up to a $300 Visa card to each employee who complies with their wellness plan. That's real money the employees can use at any point. Regardless of the size of the employer, you're eligible for these discounts, but you must know what to look for and how to ask for these discounts with your carrier. Without doubt, Massachusetts has proven to be a leader in healthcare innovation in both rules and regulations. In conjunction with what the carrier has to offer in the way of wellness, it's important to use an outside source to bring in wellness plans and communications to the employees by combining such proven techniques as on-site testing, which would include cholesterol testing, blood pressure testing, body composition analysis. It will help you to get rate relief from these health plan carriers. In addition, on-site flu clinics, water challenges, greater loser contests all add fun and improve the results of your wellness plan. Most importantly, it provides rate relief. By combining all this data with a health risk assessment that you ask employees to complete, you're armed with the information to bring to the carriers for lower rates. Next step would be to incorporate a telemedicine program into your plan. Telemedicine is definitely here to stay. It comes in many forms, but what I'm referring to is the individual approach, which includes access to an emergency physician quickly and efficiently. There are many programs out there that come across as a telemedicine approach, but it's critical to choose the right plan to get the needed results. Telemedicine today is the online banking of 10 years ago. Nobody had heard about it, but it sure sounded good. In the future, it will be in every household in America. By using state-of-the-art technology, you now have access to a plan that will put you right in touch with a board-certified emergency medicine physician. A trained non-emergency situation, by using this, you can have access to Skype technology, smartphones, or the Internet, have access to these physicians. Once you have a consult with them by using one of these methods, they can then send a prescription to your pharmacy of choice within minutes, eliminating the need to drive to the medical facility. Picture this, Your little 10-year-old son has a fever on a Saturday afternoon. You call the doctor's office, and guess what? They tell you to bring him to the emergency room. But how about if you could dial into a board-certified emergency physician, send him a digital photo, or get on a Skype to get the diagnosis, get the medicine you need sent right to your facility of choice. The next step would be to incorporate a consumer-driven high-deductible health plan choice. Depending on the carrier and the type of plan chosen, these can reduce your health plan rates considerably. The advantages of these plans are far too numerous to explain in this short webinar, but the idea is by offering these plans, you give the employees more choices to control their health care. By combining these plans with employer financial incentives, again tied to wellness, you'll be amazed at the results. And it's imperative that there be proper employee education to make this type of approach work successfully, not once, but many times throughout the plan year. In order to get the results that you need, you must continue to do this on an ongoing basis. There should not be an initial replacement of your more traditional copay plans, but a side-by-side offering to give the employees choices that they need. We've seen flat increases or very minimal increases by using this approach. Each carrier offers them. It's important to understand them and present them properly. The next step, you must constantly edit your bill for accuracy and mistakes. Although it may be time-consuming for your own staff to analyze the bills and mistakes, if so utilized, a third-party service can make sure you're getting the improper monies allocated to your plan. Without a system of checks and balances, believe me, these can add up to thousands on your plan. Make sure you have a system to also analyze your COBRA participants to make sure that you are timing their entrance and terminations properly. The system has been developed to make this much easier, something that can be done very effectively and at no cost to the employer. Next step is to recheck your census multiple times and be aware of pricing trends. Prior to renewal, we've seen dramatic rate changes with census shifts. Don't be fooled into believing that the carrier will only provide a single and a family rate for you to choose from. The latest rating technology, which incorporates the use of not only a single plan and a family plan, but also an employee and child, employee and children, and employee and spouse. There can be great variations if you do not present the proper census data right up until the last minute you make your decision. By adding one or two single employees as an example, this can dramatically change your rates. Oftentimes, these lists are drawn up 3 months prior to renewal and must be looked at right up until the final moment when your health plan renews for proper accuracy. It can never hurt you in the wrong way, but believe me, it can add up to a great deal of money by presenting the proper census. Second part is mentioned is to be aware of pricing trends. We've seen the rates for the exact same plan choice, say a $1,000 deductible plan, drop in future months as the carriers analyze their products for efficiency. You must work with a representative that understands this and is in constant contact with the carriers to get you the greatest results. Next step, get self-funded quotes to compare. Depending on the size of the group, you're eligible to receive a partially self-funded or fully self-funded comparison. There's so many new innovations in both partially or fully self-funded offerings, it would be a crime not to compare this path. We have already discussed the many ways to lower your claims, which is the basis of self-funded plan. Some plans even allow a real return of unused premium to the company in the form of money. One particular group comes in mind that actually received a check of $33,000 back in unused premium at the time of their renewal. This was right in the middle of a very high renewal period where groups were averaging double-digit increases. The ability to structure plans as you see fit, offering multiple choices, is another advantage. This truly can be a win-win situation. Again, giving the employees the many choices that they need, combined with a wellness incentive, really helps you control these plans and get you the greatest discounts. In addition, these plans are now available to groups even down to as low as 10 employees. The final step would be to meet with your health plan carriers' management teams and underwriting teams. Each group is assigned a case manager, a service manager, and an underwriter, which may be part of a larger team. The results of your wellness plans and telemedicine plans must be communicated this team throughout the course of the year through a series of coordinated meetings. Armed with this data, you're able to negotiate your greatest discounts. We have met internal underwriting teams of the biggest carriers and know what they are looking for and have proven fact-based statistics to back up our data. Do not settle for your initial offering, because if you prove to them that you're controlling your employees' health and well-being by implementing wellness plans, you will be able to demand the appropriate discounts. Thank you, and please, for more information, you can contact myself, the Health Consultants Group, at 800-367-2482, extension 414, or my email, tchandler@myhcg.com.